From the data and statistics, we've noted as a hospital that high blood pressure, that medically we call it hypertension, is one of the leading cause of morbidity in Lango sub-region. And it's not alone. The second one, as per data that we've analyzed recently, is actually malaria. And the third is dental caries as the leading cause of morbidity in the region. Hypertension medically is high blood pressure. The blood pressure that we termed as high means that when you take the blood pressure, the systolic blood pressure, which is usually recorded above, is greater than 140 millimeters of mercury, and the diastolic blood pressure that we usually put it under is greater than 90 millimeters of mercury. So in all, hypertension means blood pressure with systolic more than 140 and diastolic more than 90 millimeters of mercury. Now, you realize that most of these illnesses are actually related to lifestyles, especially hypertension, and it has a great risk factor. So when we talk about the risk factors, first of all, I wanted to give us a few informations about the normal blood pressure. The normal range of a blood pressure should be on average 120 out of 80 millimeters of mercury. But however, the blood pressure tends to change depending on the level of activities. Especially for systolic blood pressure, we look at a range of about 100 up to 135, around there. Then also the lower one should be averagely about 80. But however, you realize that most of the lifestyles that we have doesn't allow the body to adjust very well on issues relating to the blood pressures. Now, one of the big risk factors that we have around is that obesity, and then inactivity. Now, obesity, it's that we tend to overeat. We tend to eat a lot of food, but most of the food that we eat is actually high caloric content. For example, we like the food like the rice, for example, the posho, and so on. So most of these has very high level of energy giving. Most of them are energy giving, as opposed to the proteins. Now on top of that also, we tend to do a lot of fatty foods. People prefer the fried diet, highly spiced, highly processed, with a lot of fats in them. So all the fats that we have is really converted into glucose, that the body needs them in a normal circumstances. But however, in a situation that you have very high level of them in the body, they tend to cause metabolic changes in the body. Now, one of the metabolic changes that we commonly notice is even diabetes, and then high blood pressure comes in. For example, you have a change in body cholesterol, right? The cholesterol level tend to change from the normal. The lipid profiles of the body tend to get disorganized, and eventually what will happen is that the body will tend to adjust and adapt. Now, one of the mechanisms that the body responds to if you have very high level of cholesterol in the body is that the blood vessels tend to undergo changes. Now, the immediate changes that is there is that you will have depositions in the inner walls of the blood vessels. Now, once there's a lot of deposits in the inner walls of the blood vessels, there will be narrowing. And so, before even the narrowing, the normal changes where the blood vessel is supposed to open up, adjusts, becomes wider, reduces, becomes smaller, responding to different circumstances in the environment, then that now doesn't become normal. And at the end, the body would adjust accordingly by building a pressure makeup that will ensure blood is pushed from the heart to the hand systems of the body that is required for life to continue. Now, when this keeps happening, you realize that a number of things happen. The other thing that happens is that the body tends to send a lot of fats into the store for storage. Now, once you end up storing a lot of these lipids in the body, you tend to swell. Somebody becomes big compared to the size that you're supposed to be. For example, I want to ask the community, how many of us know what we call the body mass indices, the BMI? So you realize that the BMI that we are supposed to have is that supposed to be the relationship between the weight your weight, what you weigh, versus your height, how tall you are, the body surface area, right? So you realize that when, say for example, you're a very short person, but your weight is like 150 kilograms. So you realize that your body surface area in relation to the weight is not proportional. So at the end, the body mass indices, what you call the body mass index, becomes higher. So once your BMI becomes higher, you stand now at risk of most of these metabolic conditions, and one of them is hypertension. A number of times, we have not even known that we have high blood pressure. By the time you have a complication, maybe the legs start to swell, maybe you begin to get tired a little bit, or the heart begins to beat abnormally. Ideally, in a normal, real sense, you're not supposed to know that your heart is beating. But a moment, anytime, you realize, hey, my heart is beating. Even at sleep, my heart is beating. The only situation where you're supposed to know that your heart is beating is when something scares you, right? When something scares you or when you run, that is when you know, hey, my chest is heating up. But now, at rest, you realize that your heart is beating. So the most important aspect of this is that we are supposed to be able to check up ourselves, right? Every time you're supposed to be able to go to the hospital, check up your blood pressure, get to know where it falls so that you know the normal and what it is. Trigger the body to ensure that the blood vessels that is delivering blood to the kidneys are narrowed so that blood flows quickly, so that the tissues there receives the nutrients that are available and oxygen in the blood. But in this event, the body will keep adjusting until it cannot now adjust anymore. So at that time, the system begins to get exhausted, they become tired, and they start sitting back. What they're supposed to do, they will not now be unable to do at a certain time. And in that period of time, you now begin to develop evidence of kidney failure. And kidney failures, it is in stages. Initial stages, you have what they call acute kidney injury. That might turn out to become acute kidney disease, that might progress to become chronic kidney disease. Now, when the disease is not sorted out at the initial phases, you now have the late stage of the kidney disease, which is called chronic kidney disease. That eventually can translate into stage 5, which is end stage. Now, at that time when somebody has a chronic kidney disease, that means now your kidney cannot support you any longer. So that means, other than the dialysis, that is offered usually to remove the toxins in the body. What the normal kidney does, removing the toxins in terms of urine and pouring them out, that function won't be there. So at that time, you need dialysis to remove the toxin. But dialysis is not a definitive treatment, it's more palliative. You will need a kidney transplant, right? You need a new kidney. Now, a new kidney is only provided by God, but who will go back to the womb again and then you get delivered? No one. So that means somebody needs to donate for you a normal kidney to be replaced back onto you so that your kidney starts to work, your body starts to work well. But that is very expensive.